Hi, everyone. Today, we're going to talk about a really important and increasingly discussed topic. Am I autistic, or how can I know if I'm on the autism spectrum? Many people have asked themselves these questions, and that's totally normal. Autism can manifest very differently in different people, so it's common to have doubts. If you've ever thought about this or know someone who might have these characteristics, stick with me. I'll try to explain in a very simple way what autism spectrum disorder, ASD, is, what signs may indicate someone is on the spectrum, and how to seek professional help for a diagnosis. In this video, we're going to explore what it really means to be autistic, how the diagnosis is made, and what you can do if you feel these characteristics are present in your life. The goal is to bring clarity and hopefully help you understand yourself better. Let's dive in. I'm sure you'll get a lot of useful information from this. What is autism? What does it mean to be on the autism spectrum? Autism, or autism spectrum disorder, ASD, is a neurological condition that affects how a person communicates, interacts with others, and perceives the world. The spectrum in autism means there is a wide range of how these characteristics show up. Some people may have mild symptoms, while others may need more intense support. In general, autism symptoms are noticed in early childhood, but some adults only realize later in life that they are on the spectrum. These variations can include difficulties in social communication, restricted interests, repetitive behaviors, and sensory sensitivities. It's also important to understand that autism is not an illness or something that needs to be cured. It's simply a different way the brain functions, and many autistic people have unique strengths that make them exceptional in various areas. History and evolution of the concept of autism. The concept of autism began to take shape in the early 20th century. Psychiatrist Leo Kanner was the first to describe what he called early infantile autism in 1943, observing a group of children who displayed unusual behaviors, such as difficulty forming social bonds and an excessive interest in repetitive patterns. Around the same time, Austrian pediatrician Hans Asperger identified similar behaviors in children, which would later be known as Asperger's syndrome, a milder subtype within the autism spectrum. Since then, the understanding of autism has evolved significantly. Today, autism is recognized as a highly variable condition that doesn't just affect children. Many autistic individuals lead independent, productive lives in adulthood, especially with proper support. Additionally, stereotypes about autism have been deconstructed, allowing for a more inclusive and respectful understanding of the condition. Myths and truths about autism. Unfortunately, there are still many myths and misconceptions about autism, which can make it harder to understand the condition. Let's debunk some of these myths and clarify the truths behind them. Myth: autistic people don't have emotions or empathy. Truth: many people on the autism spectrum feel emotions deeply and are empathetic, but they may have difficulty expressing those emotions in socially expected ways. This can lead to the mistaken impression that they don't care, when in fact, they simply express their feelings differently. Myth: autism only affects children. Truth: autism is a lifelong condition. While the signs often appear in childhood, many autistic individuals continue to show characteristics of the spectrum in adulthood, and some only receive a diagnosis later in life. Myth: autistic people can't live independently. Truth: many autistic people live completely independent lives, especially when they receive the right support. It depends on where they are on the spectrum and their individual needs. Main signs and symptoms. Difficulties with social communication. One of the core characteristics of autism is difficulty in social communication. This can vary from person to person, but often involves challenges in understanding and using both verbal and nonverbal language. For example, some people on the spectrum struggle to interpret facial expressions, tone of voice, or gestures that most people intuitively use to communicate. Some autistic children may start talking later than others, or they may not develop traditional speech patterns. Others may talk a lot, but without realizing they're monopolizing the conversation or not noticing when others lose interest. This difficulty in picking up on social cues is one reason why many autistic individuals find it hard to connect with others. Beyond speech, there are also challenges in using body language and interpreting social signals. Eye contact, for instance, can be uncomfortable for many people on the spectrum. This can lead to misunderstandings in social interactions, as eye contact is often seen as a sign of interest or engagement in a conversation. Repetitive behaviors. Repetitive behaviors, or stimming, are another common feature of autism. These can show up in various ways, including repetitive body movements like hand flapping or rocking, arranging objects in a specific way, or repeating words and phrases. These actions can serve as a way to self-regulate, helping the person deal with sensory or emotional overload. These behaviors aren't necessarily harmful, but they can become problematic if they interfere with a person's ability to engage in other activities or adapt to new situations. Some autistic individuals develop rigid daily routines and feel extremely uncomfortable when something disrupts their plans. Restricted interests and hyperfocus. People on the autism spectrum often have very specific and intense interests, known as hyperfocus. These interests can vary widely, from common hobbies like astronomy or video games to less conventional topics, such as train schedules or detailed fact lists. The main characteristic of hyperfocus is the intensity with which the person dedicates themselves to these interests. They may spend hours researching or talking about their favorite subject, gaining deep knowledge about it. This level of interest and dedication isn't a negative thing and, in fact, can be a major advantage. Many autistic people excel in their areas of interest precisely because of this extraordinary concentration and focus. However, in some cases, the intense focus can become so dominant that the person loses interest in other activities, including social interactions. Sensory sensitivity. Another common aspect of autism is sensory hypersensitivity or hyposensitivity. This means that some autistic people are highly sensitive to sounds, lights, smells, or textures, while others may not notice these stimuli as typically perceived. For example, someone with auditory hypersensitivity might find certain sounds unbearable, such as the noise of a vacuum cleaner or people chewing. Similarly, someone with tactile hypersensitivity might avoid certain fabrics or dislike being touched by others. On the other hand, hyposensitivity means some people may seek more intense stimuli. They might enjoy repeatedly touching rough surfaces, seeking strong smells, or rhythmically rocking their body to stimulate their sensory system. The way sensory sensitivity affects each person varies greatly but can significantly impact their daily life. Challenges in interpersonal relationships. Interpersonal relationships can be a major challenge for many autistic people. This is largely due to difficulties in communication and interpreting social signals. Many individuals on the spectrum report feeling different or out of place in social situations. They may not understand certain unspoken social norms, like when it's appropriate to start a conversation or how to interpret the emotional tone of a discussion. Some autistic people prefer to spend time alone, not because they dislike others, but because social interaction can be exhausting. Others may want to make friends, but don't know how to initiate or maintain relationships. This can lead to feelings of isolation or frustration, especially when there's a desire for connection but the necessary social skills feel out of reach. Diagnosis. How is the diagnosis made? The diagnosis of autism is based on a comprehensive evaluation of the person's behavior and development. There's no blood test or simple medical test to diagnose autism. Instead, mental health professionals such as psychologists, psychiatrists, or neurologists use a combination of interviews, behavioral observations, and psychological testing to determine if someone is on the spectrum. These assessments often involve observing how the person behaves in different situations and how they interact with others. This may include interviews with parents or caregivers, in the case of children, to understand how the behavior developed over time. For adults, it may involve reflecting on past and current difficulties, as well as interviews with friends or family who can provide additional insights. The importance of early diagnosis. Receiving an early diagnosis of autism can make a big difference in a person's life. That's because the earlier autism is identified, the sooner the person can begin receiving the necessary support and interventions. For children, this can mean behavioral therapy, specialized educational support, and other interventions to help develop social and communication skills. An early diagnosis also helps parents better understand their child's behavior and provide the right environment for them to thrive. When autism is identified early, it's possible to adapt expectations and educational strategies to better meet the child's needs. Differences between childhood and adult diagnosis. While early diagnosis is ideal, many people don't realize they're on the autism spectrum until adulthood. This happens because, especially in milder cases, autism signs can be mistaken for other conditions or simply overlooked. Some people develop coping strategies over the years, which can mask some of the more obvious symptoms, especially in controlled environments like work. For adults who suspect they might be on the spectrum, the diagnostic process is similar to that of children, with the difference being that it requires reflecting on past and current experiences. Receiving a diagnosis in adulthood can be liberating for many, as it finally offers an explanation for the difficulties faced throughout life. Living with autism. The impact of autism on social life. The impact of autism on social life can vary significantly from person to person, depending on where they are on the spectrum and the skills they've developed over time. For some autistic individuals, social interaction can be a source of great stress, especially in unpredictable situations or large groups. They may prefer one-on-one interactions or conversations about specific topics in which they feel more comfortable. For others, the impact may be less noticeable, but still present. For example, someone may have reasonably developed social skills, but still struggle to understand subtleties like sarcasm, irony, or body language. This can lead to misunderstandings in relationships, both personal and professional. Education and school inclusion. School inclusion is a central issue for autistic children. Many schools have made significant progress in creating inclusive environments where children on the autism spectrum can learn alongside their neurotypical peers. However, the success of this inclusion largely depends on the level of support the child receives. Some autistic children may benefit from a modified curriculum that takes into account their learning needs. This might include the use of visual aids, structured schedules, or support from a classroom aide. The goal is to ensure that every child has the opportunity to reach their full potential, regardless of the challenges they may face. Autonomy in adulthood and at work. Many autistic people are able to achieve a high degree of autonomy in adulthood, especially when they receive adequate support and interventions early on. The transition to adulthood can be challenging, but with the right tools, many autistic individuals find satisfying jobs, live independently, and build meaningful relationships. In the workplace, autism can be both a challenge and an advantage, depending on the context. Some autistic individuals excel in careers that involve attention to detail, analytical skills, or working with technology. However, the work environment may need to be adjusted to accommodate sensory sensitivities or the need for structure and predictability. The importance of support networks. Having a support network is crucial for anyone's well-being, and this is especially true for autistic people. Support networks can include family, friends, therapists, and autism support groups. These networks provide not only emotional support but also practical guidance in facing everyday challenges. Having a welcoming and understanding environment can make all the difference for someone on the autism spectrum, helping them overcome obstacles and achieve their goals. For many, knowing they're not alone on this journey is a huge relief and provides motivation to keep moving forward. Treatments and interventions. Behavioral therapies. Behavioral therapies are one of the most common approaches to treating autism. Applied behavior analysis, ABA, for example, is a widely used therapy to teach social and communication skills while helping reduce problematic behaviors. ABA is based on positive reinforcement to encourage desirable behaviors and teach new skills, helping autistic individuals better adapt to social environments. In addition to ABA, there are other therapeutic approaches that can be effective, such as cognitive behavioral therapy, CBT, which focuses on changing patterns of thought and behavior. These therapies can help autistic people cope with anxiety, stress, and other emotional issues by providing tools to better manage their emotions and reactions in challenging situations. Occupational therapy and speech therapy. Occupational therapy is another important intervention for autistic individuals, especially those who face sensory difficulties or motor coordination challenges. Occupational therapists help improve fine motor skills, such as writing or using utensils, and gross motor skills, like balance and coordination. Additionally, they can work with autistic people to develop strategies for dealing with sensory overloads. Speech therapy also plays a fundamental role in treating autistic people who have speech and communication difficulties. Speech therapists can work to improve articulation, expand vocabulary, and develop functional communication skills. In some cases, alternative communication therapies, such as using tablets or symbol systems, may also be explored. The importance of environmental adaptation. Adapting the environment is a crucial intervention for improving the quality of life of autistic individuals. This might mean making adjustments in school, the workplace, or at home to accommodate sensory sensitivities or specific routine needs. In noisy environments, for example, noise-canceling headphones can help the autistic person feel more comfortable and less overwhelmed. For autistic children, having a structured and predictable routine can reduce anxiety and help them feel more secure. In the workplace, small accommodations like allowing frequent breaks or providing a quiet workspace can make a huge difference. Medications, when are they recommended? Although there's no cure for autism, certain medications can be used to treat specific symptoms, such as anxiety, depression, hyperactivity, or obsessive behaviors. These medications are prescribed by a doctor and should only be used when necessary as part of a broader treatment plan that includes behavioral therapies and emotional support. Medications can be helpful for some autistic people who face significant challenges in specific areas, but they are not a universal solution. The decision to use medication should always be made in consultation with a healthcare professional who understands the individual's unique needs. So, how did you like the video? I hope it helped clarify some doubts about autism and offered a better understanding of this complex and fascinating condition. If you've made it this far, I want to thank you sincerely. I truly believe that the more information we have, the easier it will be to help people understand and accept themselves, whether they're on the spectrum or not. If you enjoyed the content, leave a comment below sharing your thoughts. Your opinion is really important to us. And, of course, don't forget to subscribe to the channel so you don't miss any videos. We'll continue talking about important topics and bringing information that can help many people. See you next time, and remember, you're amazing just the way you are.